Hi, everyone that's still at home. Here's your YouTube lecture. We're going to cover Chapter 7, so careers in the health industry. This is a fun chapter, I believe. So you're going to look at different types of physicians, nurses, allied health, and I don't think we're really going to look at education programs. So did you know the health industry is one of the largest employers in the United States? About 65% of U.S. physicians are specialists, which is kind of a problem because we need more primary care physicians. Approximately 80% of the health industry employees are female. Female just tend to be more caregivers. Obviously not saying males can't be that too, but it's just a tendency for females to do that. And then nurses are the largest group of healthcare professionals in the United States. So because of the aging of our population, we've referred to it as the graying of America. The Bureau of Labor Statistics indicates that the health industry will generate nearly 2.5 million new jobs by 2026. So these are new positions that will need to be filled by 2026. It's a lot of new jobs. And when one thinks of healthcare providers, one automatically thinks of physicians and nurses. Everybody knows who a doctor or a physician or a nurse is, but there are a lot of other professionals, and they're allied health professionals, and they represent more than half of the healthcare workforce, and they provide a range of essential healthcare services that the doctors and nurses cannot provide. And these services complement the services provided by physicians and nurses. And I'm an allied health professional because I'm a laboratory technologist, medical laboratory technologist. And the thing I run into is that even among people that know me, they still assume that I'm a nurse, which is somewhat aggravating. In most states, only physicians, dentists, and a few other practitioners can serve patients directly without the authorization of another licensed independent health professional. So they have authority, if you will, of the patient. They can prescribe things. They can, decide what a treatment is without anybody looking over their shoulder. Some of the other practitioners mentioned are chiropractic care, optometry, psychotherapy, and podiatry. So these all can practice independently. Most states can some states also authorize midwifery and physical therapy. This means, for example, that if you're a nurse, you're not allowed, just an RN, for example, you're not allowed to practice independently. That means you cannot make up your own orders for your patient. You have to have a doctor's orders. As a lab tech, I have to have a doctor's order for any tests that I run in the lab. If you're x-ray tech, you have to have a doctor's order for any x-rays that you do. There also continues to be a shortage of nurses nationwide and even allied health. There's a shortage all over the healthcare industry. It is projected that nursing shortages will continue to lag behind the staffing needs. And we're going to look at different types of healthcare professionals and their role in providing care in the healthcare system. Now, we're going to start with physicians, starting at the top, and talk a little bit about physician education. So we have doctors of medicines, which are MDs, and doctor of osteopathic medicines, which are DOs. And there's a big difference between them two, but there's a lot of things that they have in common. So MDs use an allopathic approach, which means MDs actively intervene in attacking and eradicating disease, and they focus their efforts on the disease. One of the things that sometimes I disagree maybe a little bit with the way MDs or allopathic medicine is approached is that they often will just use pharmaceutical interventions. So it seems like their model of training is that you prescribe a medication for the problem, for the disease, in order to try to help the disease. DOs tend to stress preventive treatments and use a holistic approach to treating a patient, which means they do not focus only on the disease, but on the entire person. Most DOs are generalists, and so a DO would be probably more likely to address your diet and lifestyle in that. Not saying an MD wouldn't, right? Because MDs could still do that if they choose to, but DOs are more trained to look at that and look at the whole person and how everything is interconnected. So two programs in the state now is, of course, we have UAMS is a MD med school, and NYIT here at A-State has a DO program. I believe there's another DO program. So this video on MD versus DOs is Dr. Mike. If you will watch it in your Nearpod, it answered a few questions that are in there. I appreciate it. If you're out on YouTube, you should look that video up. It's a really good one. Explains the difference between MDs and DOs. Okay, so then a quick little poll question. A cardiologist would be more likely to be what, a DO or an MD? All right, so let's talk a little bit about how, physician compensation, so the pay for physicians. So in 2016, there were 714,000 physicians in the U.S. The Association of American Medical Colleges projects a physician shortage of 40 to 100,000 physicians by 2030. This is just not even 10 years down the road. And if you think of the time to get medical education, to get residency and all of that kind of stuff, like, we really need to be thinking about this. Wages for physicians and surgeons are among the highest of all occupations. So it pays really well. It is expensive to go to med school, but it pays really well. And the differences in salaries are a reason for shortage of generalists in specialty maldistribution, meaning that we have a lot of MDs going into specialty simply because they can make more money, but we have a need for more generalists, but it is one of the lowest paying physician jobs, and so a little harder to attract people to that. All right, next poll. Which of these specialists do you think earns the most? So you have a list there, and if you will click here, it has actually, so I'll show there for you guys. So the ones that make the most are orthopedics, and then plastic surgery, and then otolaryngology, so those are ENT, ear, nose, throat doctors, and then followed by cardiology, dermatology, and then radiology. And then gastroenterology, and it goes down, and then you see pediatrics and family medicine and public health and preventive medicine is all the way down here at the bottom. All right, generalists and specialists. So generalists are also called primary care physicians or primary care providers. The family care practitioners are also called generalists, as are general internal medicine physicians and general pediatrics. Those are all generalists because you can go see them for a range of different problems. And they really should be the ones to coordinate your care. Their focus should be on preventive services, just as immunization, health examinations. So you should have a yearly checkup with your generalist, with your primary care provider. They often serve what we call as gatekeepers for patients, which means they coordinate patient care, and if a patient needs to see a specialist. So it is, with their assessment, if they think that, for example, you're having some heart troubles that are just beyond what they could treat, or they, feel it would be better for you to go see a cardiologist, then that would be a decision that they can say, hey, we need to refer you to cardiology, and they can refer you to a specific one. Maybe somebody they know or somebody that they know is good. Specialists are required to be certified in the area of specialization, and so this may require additional years of training and require a board certifying or credentialing examination. So after they go to med school and all that, and then they do their residency, and then they do additional years in whatever field, then they also still have to make sure, they have to take their certifying boards and all that before they can practice as a cardiologist, as, an anesthesiologist or whatever. So the most common specialties are dermatology, cardiology, pediatrics, pathology, psychiatry, obstetrics, anesthesiology, specialized internal medicine, gynecology, ophthalmology, radiology, and surgery. So again, a little bit about hospitalists. So hospitalist is a physician who provides care to the hospitalized patients. They don't usually have their own practice. Well, they don't have their own practice. They just all located at the hospitals. And they replace the patient's primary care physician while the patient is at the hospital. And hospitalists are trained to monitor the patient from admission to discharge. And but you don't usually have a professional relationship with that patient before the admission to the hospital, and even after the discharge, unless they happen to be readmitted later. This is a new type of physician. It evolved in the late 1990s. It's usually a general practitioner because they're seeing all kinds of different patients all over the hospital. It is becoming a more popular choice. And they are better at providing hospital care because that's all they do, so they know how to do good, efficient hospital care. From a hospital's viewpoint, the focus is maximization of profit, which means shorter lengths of stay, decreased complication, and increased patient satisfaction. So there are 457,000 hospitalists in the United States. That's a lot of hospitalists. So now let's move on to non-physician practitioners. So this is a general term, and it includes non-physician clinicians and mid-level practitioners. And so let's look at these. So they are called physician extenders because they often are used as a substitute for a physician. They are not involved in total care of a patient, so they collaborate closely with a physician. They'll often be like working with a physician in a clinic, usually in primary care. The categories of non-physician practitioners are your physician assistants, your nurse practitioners, and your certified nurse practitioners. So these non-physician practitioners, play an important role in areas that are underserved by physicians, such as rural and underserved urban areas. So we're kind of in a, well, I would say somewhat underserved, but we're in a generally rural area. If you just get a little bit away from Jonesboro, there's a lot of little rural towns and stuff. And so these nurse practitioners and PAs and stuff serve in a lot of the clinics, and they help provide care to physicians, to patients, whereas the physician wouldn't be able to see everybody. And so they work in community health centers, they work in managed care. So they can be used with repetitive technical tasks, such as screening for diseases. They also take care of non-life-threatening cases in ER. They can perform physicals, drug testing, and other routine activities. The salaries of non-physician practitioners are nearly 50% less than physician salaries, so they are very cost-effective. And so they usually handle all the minor stuff, preventive stuff, quick assessments and that kind of stuff. So let's talk about physician assistants. So a category of these non-physician practitioners. So they can provide a range of diagnostic and therapeutic services to patients. They take medical histories, they conduct patient exams, they analyze tests, they make diagnoses, and they perform basic medical procedures. They are able to prescribe medicines in all but 3 states in the United States, and they must be associated and supervised by a physician, but the supervision does not need to be direct. That means that the physician does not need to be located at the facility that the PA is, but the PA needs to be able to basically pick up the phone and call the physician and ask them the questions. So the physician could be in a bigger town somewhere else, and then they're in a little rural clinic, and as long as they can contact their supervising physician, they are free to practice. In many areas where there's a shortage of physicians, these physician assistants act as primary care providers. They collaborate with physicians by telephone and on-site visits. There are 200 accredited 2-year PA programs. So this is a grad school, so you have to usually have a bachelor's first before you can apply to a PA program. The employment growth is expected to be 37% by 2026, and the median annual salary is $104,600. All right, so let's talk nurses, and in there we're also going to cover nurse practitioners. So nurses continue to be the largest group of healthcare professionals. They provide the majority of care to patients. They're the ones that do the hands-on care, that carry out the physician's orders. They are also the patient's advocate, so they can take the patient's complaints or concerns to the physician. Several different types of nurses provide patient care. There are different levels of nursing care based on education and training. So the licensed practical nurses, this is the lowest level of nursing. There are approximately 724,000 LPNs in the U.S. They are the largest group of nurses and provide basic nursing care. Education is offered by community colleges. Community colleges are 2-year colleges, okay? Or by technical schools. The training takes anywhere from 12 to 14 months, so it's about a 1-year training. So it's not an associate's degree, and includes both education and supervised clinical practice. So to get classwork and to get clinicals. They work primarily in hospitals, home health agencies, and nursing homes. Nursing homes employ them very heavily, and the median salary is about $35,000. Around here, ASU Newport, there's ASU Newport Jonesboro, that's over there on Kruger Drive, and there's of course a campus in Mocktree and a campus in Newport. So that's a community college. It's a 2-year school, and they have an LPN program, and of course Black River Technical College. There's also ANC. Anyway, so those are different places where you can get this 1-year training. Now, registered nurses, RNs, they are trained nurses who have been licensed by a state board after passing the National Nursing Examination. Now, you also do have to pass an exam to practice as an LPN, so don't think you don't have to do that. But our RNs is the next level, okay? They can be registered in more than one state. And there are different levels of registered nurse based on their education. There's an associate degree, which is about a 2-year degree, or a 4-year degree. The 4-year degree is usually called the BSRN or BSN-RN. Their annual salary is around $70,000. So the BSN is the most rigorous of all the nursing programs. They're offered at colleges and universities, so not at community colleges. So it has to be a 4-year university, and usually take 4 to 5 years to complete. Now, there's just the plain RN or the associate RN is an associate degree, so that usually takes somewhere between 2 to 3 years to complete, depending on the school. And then we have advanced practice nurses or mid-level practitioners. So these are nurses who have experience and education beyond RN. So this is beyond bachelor's. So we're at the master's level, or even sometimes at the doctoral level. They operate between an RN and an MD, which is why they are called mid-level practitioners. They normally obtain a Master of Science in Nursing, although there is now a doctorate in nursing too, the DNP. With usually a specialty in their field of practice. So the nurse practitioners are the largest category of these advanced practice nurses. They are required to obtain an RN, so you have to be an RN before you can be a nurse practitioner, and then a master's degree or a doctoral degree. Again, it kind of depends on, we do have a doctor DNP here at A-State. They may receive a certificate program and complete direct patient care clinical training, so they'll have clinical rotations as part of their studies. The nurse practitioners emphasize health education and promotion as well as disease treatment, referred to as care and cure. They can write prescription in all states, and there are about 248,000 nurse practitioners in the United States, and the annual average salary is $105,000, so very, very similar to the salary of physician assistants. Okay, so this is a good little video on nurse practitioners versus PA. This is Will from Wellness. Can't remember the whole name of it. So just watch the video; it's really good. So, who would you prefer to have as your primary care provider? Would you like a nurse practitioner, an advanced practice RN, a DO, an MD, or a PA? What do you think? What would be your primary choice? So again, this is just. There's no right or wrong answer. What would you prefer? All right, then we have our certified nurse midwives. So certified nurse midwives are RNs who have graduated from a nurse midwifery education program and has been accredited by the American College of Nurse Midwives' Division of Accreditation. So nurse midwives have been practicing in the United States for nearly 90 years, and the average annual salary is $105,000. In case you don't know what that is their job is to deliver babies. This is what they do. So if you want to deliver your baby at home, you could actually hire a certified nurse midwife to do that. So and there's also, they can work in birthing centers and stuff. So certified midwives, which are not the same as certified nurse midwives, are individuals who do not have a nursing degree but have a related health background. They have to take the midwifery education program, which is accredited by the same organization, and their average annual salary is about $65,000. So a little bit level below the nurse one, because there's, you don't have to have that RN. Then our nurse anesthetists, so the CRNAs, they provide anesthesia and related care before, during, and after surgery. They provide pain management and some emergency services. The average annual salary for a CRNA is $165,000. To apply and be a CRNA, you first have to have your bachelor's RN, and you also have to have quite a few years, I believe it's somewhere anywhere between 3 to 5 years experience in settings such as ER, ICU, surgery, or something like that. Now, the certified nursing assistant, we're going back kind of like back down to the lower level. They are not licensed, so they're unlicensed patient attendants. They are not really nurses, they're nursing assistants. They work under the supervision of physicians and nurses. So they answer patient call bells, they assist patients with personal hygiene, they change beds, they order meals, they assist patients with their activities of daily living, which means they would help patients get dressed, they would help patients take a shower, get their clothes on, like I just said, or, brush teeth or whatever they need. They help their patients get up and down out of the bed. And so most CRNAs are employed by the nursing care facilities, and their annual median salary is $27,520. These gals or guys work really hard. This is a very hard job because they're constantly helping people, and they might be lifting them and stuff like that. And so it's a very demanding job for the pay that they get. Okay, so next poll question. So what is the requirement to be a CNA, so a certified nurse assistant? So there we go. We got 3 choices. See what you think. All right, so now let's dive into other health professionals. We covered the physicians, we've covered the nurses and other non-physician practitioners and stuff, which is what everybody's always familiar with. So let's dig into other. So dentist is where we're going to start. To prevent, diagnose, and treat teeth, gum, and mouth diseases. They are required to complete 4 years of dental school from an accredited dental school once a bachelor's degree is completed. Often people that want to go into dentistry will get a bachelor's like in biology or pre-professional of some sort, maybe some chemistry, something like that. They apply to dental school, they have 4 years of dental school, and once they're done, they're awarded a doctor of dental surgery or a doctor of dental medicine. There are nearly 153,000 dentists in the United States. More than 90% are in private practice and are primarily general practitioners. Their average annual income is $158,000. Then we have dental hygienists. I have a friend that's a dental hygienist. They clean teeth. They examine patients for oral diseases and provide other preventative dental care. So when you go get your teeth clean at the dentist, you see your dental hygienist. You don't usually see the dentist unless you need a quick little checkup. They educate patients on ways to improve and maintain oral health. They can give you suggestions sometimes on different products to use, or different brushes and stuff like that. The dental hygienists typically need an associate's degree in dental hygiene. This occupation is expected to grow by 20% by 2026, and the median salary for dental hygienists is $74,000. Pharmacists. So pharmacists are responsible for dispensing medication that has been prescribed by physicians. They can advise patients and healthcare providers on side effects of medications and how to take it, and answer questions about medications. The Doctor of Pharmacy programs require applicants to have taken post-secondary courses such as chemistry, biology, and anatomy. So you have to have your bachelor's, in one of these courses, and then you can apply. So you need at least 2 to 3 years of undergraduate study. For some programs, applicants have to have a bachelor's degree. Not all programs are that way, but if you don't have to have a degree, then you'll have to have, there's a requirement for so many hours of chemistry, biology, anatomy, and all of that. Approximately 25% of the pharmacists work in hospitals. The rest of them work in retail. And the median annual salary for a pharmacist is $124,000. Then we have chiropractors. So they take a holistic approach to treating their patients, which means they focus on the entire body with an emphasis on the spine. It requires a Doctor of Chiropractic degree and a state license. And the median annual salary for a chiropractor is $68,640. So you'd have to look up the chiropractic school and what their requirements are to apply. Then optometrists, also known as doctors of optometry. So there's ODs, not DOs. Okay. They are the main providers of vision care. So if you have classes like I do, you, I'm sure, have an optometrist that you go visit at least annually to get your checkup and update your lenses or something like that. They, so of course, are the main providers of vision care. They examine people's eyes to diagnose vision problems. They may prescribe eyeglasses or contact lenses. It does require a doctor of optometry degree, and their median annual salary is $110,000. Then we have psychologists. They study the human mind and human behavior. Some work independently, doing research or working only with patients. Others work as part of the healthcare team, collaborating with physicians, social workers, and others. A psychologist can complete a PhD in psychology or a doctorate of psychology degree. The average median salary is $77,000 for a psychologist. Podiatrists provide medical and surgical care for people suffering from foot, ankle, and lower leg problems. Podiatrists have to have a doctor of podiatric medicine degree, which is a 4-year degree after earning a bachelor's degree. There are more than 11,000 podiatrists nationwide, and their median annual salary is $127,000. So now let's jump into the allied health professionals. So these are more kind of at the level of maybe the nurses and stuff like that. So they're not advanced practice. So there are 4 main categories that they've put. So laboratory technologists and technicians. And in here, I really feel that we need to add also our X-ray technologists and technicians and all the medical imaging people. So diagnostics, if you will. All the diagnostics, and then therapeutic science practitioners. So these would be your PT, physical therapy, occupational therapy, speech pathology, and all of those. The behavioral health scientists and stuff. And so we have maybe social work can be included in there, and other support services. For example, there's also respiratory therapy and all that, and so your EMT, so and paramedics and stuff like that. So we've got quite a few practitioners here. They provide support to physicians and nurses. A lot of time, their particular skill is a skill that neither physicians nor nurses have, and often it can be a support for physicians and nurses, of course, and answer questions about their particular field. The Commission on Accreditation of Allied Health Education Programs accredits 2,000 U.S. programs that offer allied health specialties. So list an allied health profession of interest to you. So obviously this can't be physician or nurse, so one of the others. What do you know about what is interesting to you? All right, and then in our conclusions, so healthcare personnel represent one of the largest labor forces in the United States. This chapter gives us a quick overview of the different types and professions in the healthcare industry. Some require many years of education, others can be achieved through 1 or 2 year programs, and some even on the job with their CRNAs, right? There are more than 200 different occupations and professions among the millions of healthcare workers, and so we did not cover everything that's available out there. And if you have any questions, put it there and I'll be glad to answer it. And thank you for your attention.